Hello, this is Joel with Achieva Rehabilitation, provider of physical therapy in Schuylkill and Luzerne counties. We come right to your home with our intensive 60-minute one-on-one sessions. In this podcast, we are going to be providing some tips and tricks and advice for different things that people are suffering with. Please continue to look for new podcasts as they roll out, and we hope you sincerely gain some value from today's podcast. In today's special podcast on living better with Parkinson's disease, I will share with you some very powerful principles and strategies that you can make work for you along your road. There's a great saying that goes, "How do you eat an elephant?" And the answer is one small bite at a time. Living with Parkinson's is a big challenge. The best thing to do is break it down into small ideas and tips, and it's often the simplest advice that wins in the end. So before we get started, here's my challenge to you. As you start to digest this information, please take time every day to try out at least one of the strategies in this podcast. It won't take long, and most of them won't cost you anything but a few minutes of your time. We are hoping that you'll be pleasantly surprised by how much better and healthier you will feel for doing so. Step one in learning to live better with Parkinson's disease is to actually get to understand some of the problems. Without knowing what's going wrong, it's almost impossible to push for progress. Examining and analyzing the movement problems that you might have with Parkinson's disease is something that a physical therapist is an expert in. And it's a shame that some people still don't know how easy it is to self-refer to a physical therapist who specializes in Parkinson's disease care. I want you to stay tuned later for a few things in the podcast. Number one, I'm going to have you learn a little bit more about our free discovery visits, where we actually meet face-to-face with no strings attached to learn more about you and help you make great decisions on how to deal with your Parkinson's disease. Number two, I'm going to save our best tip for last. It's an exciting tip that we love to provide to our Parkinson's patients, and it helps them mobilize better throughout their day. So stay tuned for those till the end of the podcast. The podcast that we're getting into today is going to be geared quite a bit around exercise. Recent studies are showing that intensive exercise is safe, and it delayed worsening of Parkinson's symptoms such as loss of muscle control, trembling, stiffness, slowness, and impaired balance. So we've been using that in our in-home physical therapy program for quite some time. We work really hard with our Parkinson's patients, and the results are astounding at times. If you go to our website, you will find plenty of reviews and testimonials from people who have gone through that system and have done amazingly well. One off the top of our head was a patient who on day one could not get out of his chair without assistance, and on the last day of our treatment, he was hiking with me in the woods near his home. So intensive exercise works really, really well. But there's a lot of questions that people might have surrounding that topic, not knowing enough about it and how to implement it into your life to live better with Parkinson's disease. So question number one is, how do I find what exercise works for me? In studies, experts are recommending beginning physical therapy as soon as possible after a diagnosis of Parkinson's. It's never too late to get started. A physical therapist can help guide you to the best exercise program for your needs, as well as help you improve your mobility. Believe it or not, highly intensive exercise has proven great benefits for people with Parkinson's disease, like we said. At Achieva Rehab, in our in-home physical therapy program, we educate and train our patients to think of the relationship that they have with their Parkinson's disease as a heavyweight championship boxing match. Every single day, Parkinson's disease is the opponent, and Parkinson's is keeping you from winning the battles of the day. You have to look at it as a fight, and every little battle that you win gets you closer to winning the war. Another question that people have is, are there certain exercises to do for non-motor symptoms, meaning non-movement symptoms? The answer is you can tailor most exercises to work on memory and thinking. For example, while exercising, you can do math problems or name as many items as you think of in a category, such as animals or automobiles, in 1 minute. There are many other suggestions that your physical therapist can provide along the way. A big question is, can exercise worsen Parkinson's disease? Pushing yourself too hard or lifting too much weight or with improper form, for example, can result in injury. People with Parkinson's may notice that some symptoms, such as tremor, increase during exercise, but this does not mean tremor will worsen over the long run. If you're new to exercise, a physical therapist can help you start slowly and gently increase the intensity. So how hard should you push yourself? Everybody's an individual. Everybody has a different limit with exercise. With time, you will learn your boundaries and how to push them. It's best to keep a log of when and how much you exercise, when you take your medications, and how you feel to help you determine the best type and amount of exercise for you. Remember that symptoms fluctuate, so some days may be better than others. If you're just beginning, a physical therapist can prescribe an exercise routine that you can gradually add exercises and intensity to until you find your limit. One of the big things about exercise and Parkinson's is, how do you slow the disease progression? Is that even possible? The thing about exercise is that it has protective effects on brain cells. It boosts trophic factors, which are like fertilizer for brain cells, and increases the number and activity of what we call mitochondria, which are the cell's energy sources. It also helps you use your dopamine in your brain more efficiently. So in Parkinson's disease, dopamine is the brain chemical that is responsible for normal movement, and that chemical in your brain is not present as often in people with Parkinson's, and thus your movement is affected greatly. Studies are also suggesting that symptoms may progress more slowly in people who exercise. So if you exercise versus not exercise, and the progression of the disease takes the same course and pace, when you exercise, studies are showing that that pace is slower. So you will be able to live independent for much longer. Our philosophy as a company is to make sure you make your exercise program intense, because the studies are showing significant effectiveness. A program driven by an experienced physical therapist is the best way to take advantage of what you're learning here. So when we look at exercises for Parkinson's, we break things down into 4 stages. Physical therapy can be helpful throughout your journey with Parkinson's, and the interventions follow those 4 stages. Stage number 1 is what we call Prehabilitation. In this stage, it's more preventative. You start working on a problem before you even experience symptoms. You want to begin an exercise program even if there are no noticeable difficulties with balance, stiffness, or movement. You can ask for a referral immediately to a physical therapist as soon as you receive a Parkinson's disease diagnosis. Of course, with our company, we're a direct access company, which means you don't even need to see a physician for a referral. You can call us directly to begin your therapy. We believe that starting therapy right away is essential. We believe it's essential to start right away as soon as you know that initial bell has rung in your fight against Parkinson's disease. You start to develop habits right then and there that will allow you to live better with your progressive disease. So that's stage number 1. Stage number 2 is rehabilitation. At this point, you're starting to notice some symptoms, but you can take steps right here to fix the problems. You want to continue your exercise program, learn how to walk better, get up from bed or chair, get out of a freezing episode, and improve posture. Those are the things that are worked on in stage number 2. Stage 3 is preservation. During this stage, you want to do your best to make sure you do not lose what you have. It's absolutely critical that you stay active, join a group of people exercising, get physical and social, and have fun. In stage 4 is prevention. The stages come full circle. You do not want any new problems on top of existing challenges. So you have to continue your exercise program. You may be further on in the progression of the disease, and there is no timeline for this. Everybody progresses differently. But you may have to learn about home modifications, care partner training, and ways to stay strong. What we want to share with you today is just one small piece of an exercise program that we would prescribe for you. There are many areas of your body that we work on when someone has Parkinson's disease. Balance, endurance, functional strength, all those things work together to make sure that you're functioning as well as you can. One of the things that you can do on your own as someone living with Parkinson's disease is work on an endurance building plan. As we said, we like an intensive program. So what's recommended is 2.5 hours per week, at least 30 minutes of exercise, intensive exercise per day. With endurance building exercises, we're talking about walking, jogging, swimming, dancing, biking. For maximum benefit in people with Parkinson's, research suggests that aerobic activity should be at a moderately high to high intensity or pace. So one of the ways you can test if you are exercising to an intensity level that is effective is to take your heart rate. Typically, depending on your age, you want to be working up around 75, 80, 85% of your max heart rate. Maximum heart rate is calculated by taking the number 220 and subtracting your age. So if you are 60 years old, your maximum heart rate should not exceed 160. Now, what we recommend is working up to around 75% to 80% of that maximum heart rate number. So for a 60-year-old gentleman or woman, the target heart rate that you want to be taking as your pulse when you're exercising aerobically to build your endurance will be 80% of that 160 or 128 beats per minute. So I hope that makes sense to you. If not, please just ask us questions, get in touch with us. Lastly, I'm going to give you some bonuses because there's one aspect of Parkinson's disease that can be particularly disturbing, and that is freezing. A lot of people ask about freezing and exercise and what you can do about it. At further stages in the disease process, you can experience this freezing during movement, or you can also have a difficulty in initiating movement. For example, you may be walking forward and be required to make a direction change. And although you are telling your legs what to do, they don't move. They just get stuck. It almost seems impossible to get things going. Or maybe you are trying to get out of a chair and you just can't seem to start that engine to get it moving. This is classically known as freezing, and it may impact your ability to perform exercises such as walking or stationary biking because it has a great effect on what we call reciprocal or side-to-side movement, such as left and right walking patterns, left, right, left, right. So we always want to give you some bonus tips, and these are some ways on how to kind of trick your mind and how to deal with freezing if and when it arises in your activity. So I have 9 tips that you can try and implement and see which one works for you or your loved one that is dealing with Parkinson's disease. So number 1, if you start to freeze, try another movement rather than what you've been doing. So if you're walking, try another movement such as raising your arm, touching your head, pointing to the ceiling, and then pause and restart. Number 2 is change direction. If you can't move forward and your feet are frozen and stuck because they're not going forward, try stepping sideways and then go forward. Number 3, I like this one. Carry a laser pointer in your pocket. When you start to freeze, shine the laser in front of your foot and step on the light. Sometimes this cue can help you restart that motor and get that reciprocal movement going again. Number 4, visualize an object on the ground in front of you and try to step over it. Just picturing something on the ground like a puddle and trying to step over it sometimes gets that brain kind of kick-started. I like this one. Try humming a song and time your restart with the beat of the music. The human body and the brain loves music, and that's a little teaser for later on. Number 6, count 1, 2, 3, go, and then step forward. So this rhythmical approach to stopping the freezing can really touch on different parts of the brain to get started again. Another one we like, number 7, is simply weight shifting from side to side for maybe 10, 15, 30 seconds to try and initiate that first step again. Number 8, in a similar fashion, is trying to march in place a few times and then simply translating that marching forward into walking. Number 9, don't try and fight the freeze by trying harder to step forward. What you want to do is shift your attention from moving the legs to doing something else, or at a minimum, just stopping, taking a deep breath, and we just call it resetting your engine. Give your brain a little time to kind of restart things and gather to move again. So I hope those will help. I think they're interesting because they work different parts of the brain when you think of those things, and sometimes it can compensate for that freezing, which is very problematic in a lot of people with Parkinson's. So the last thing I want to do is give you one of our biggest tips. And it seems so very simple, but it gets back to the fact that human movement is very rhythmic. If you break it down to its simplest form, walking is just like music. Left, right, left, right, left, right. Music is always counted. It's always has a tempo. 1, 2, 3, 4. Left, right, left, right. So there is a bit of a relationship there, and music is our biggest secret. So music in general has just a great ability that not many people can explain, but it touches your brain and touches your life in so many different ways, and it's actually very closely related to building intelligence. So we know that music has a great effect on the mind, and we all love it in general, and so too does the brain of people with Parkinson's disease. Since the disease process itself has a great effect on coordination of movement and the initiation, the starting of movement, we have found that the addition of rhythmic music can have a great effect on the performance of activities such as walking, changing directions, clearing feet, and preventing freezing. When you begin to do your exercises or work with your physical therapist, try doing exercises with and without music, either in the room or on earbuds, and see what happens. We're very optimistic that your abilities will be much better in the presence of music, and we think that you can use that going forward if you are suffering with Parkinson's disease or your loved one has issues concerning Parkinson's disease. Also, if you find yourself freezing again and can't have music on, we said this earlier, try humming or singing your favorite song in your head. It's a great tactic to kind of get things going. So, what to do next? There's a lot of information, a lot of valuable tips in there that hopefully can change your life profoundly today and going forward. But I've saved our best piece of advice for last. The best advice that I can give you today is to seek the help of a physical therapist that specializes in and has a great deal of experience in treating people with Parkinson's disease. Our program, our in-home program with Achieva Rehabilitation, specializes in treating people with Parkinson's disease, and we also specialize in helping those people get back their activity levels and independence without pills or a calendar full of medical appointments. So right now we have 3 other easy ways to continue your relationship with Achieva Rehabilitation. Obviously, you've listened to a lengthy podcast, and hopefully it's been beneficial. But ultimately, we want to move you ever so close to the solution that you need or your loved one needs to fight that Parkinson's disease every single day. So I want to give you a few things to hopefully think about doing. These are calls to action because I believe the longer you wait, the longer it takes for you to benefit from our education and our experience. So number 1, simply call us, 1-888-929-7677, and we'll get your program started with us with physical therapy. You don't even need to go to your doctor. We'll take care of all the details. We'll get in touch with your doctor so that we're all in communication, because I think it's vastly important to have all your healthcare providers on the same page. Number 2, you can go to our website and schedule a free phone assessment. So www.achievarehab.com. At the top of that page, there's a button that says free specialist phone call. You can go in and put in quick pieces of information and arrange a phone call with our therapist to go over information and go over your challenges and just kind of get a better understanding of what you're dealing with so that we can help you make the best decisions in how to fight your Parkinson's disease. Number 3, you can arrange a free discovery visit to meet us in person to, again, just discuss things, discuss your challenges, discuss our therapy program, and discover some things that can be done for you through our in-home PT program. Go to our website, www.achievarehab.com, and you'll see buttons for a free discovery visit, and we can arrange that with you as well. It's completely free, no strings attached. So I wanted to thank you for listening all the way to the end of this podcast. I hope that you have found everything in it extremely valuable. In the end, these are things that you can do on your own on a daily basis. But in all honesty, nothing will replace a great physical therapy program to either get you started on the exercise that your body needs for that fight against Parkinson's disease, or if you are a little bit more advanced, to help gain back that independence, gain back the ability to have the activities that you enjoy and enjoy your life again, because you're fighting a fight every single day against Parkinson's disease, and we want to be in your corner every step of the way, going all the way as far as we possibly can. So please let us know if you have any questions. Again, you can always text us at 1-888-929-7677. Please start implementing these things right away. Let us know how they are. Reach out to us. We just want to be involved and develop a relationship that gets you towards the solutions that you're looking for. Take care.